hepatitis.
Yes. If you
It's over here.
Yes.
Okay. There's some of it. Some of it's on here. All right. We'll just read Dr. Bernacki's notes.
Okay.
Moving on.
So we have cirrhosis, hepatitis, and pancreatitis. Actually, I don't have hepatitis down here.
Oh, okay. Well, then I'll just go. Yeah. All right. It's my turn. My turn again.
Yay!
Hepatitis. So, signs and symptoms are rash, angioedema, arthritis, fever, and malaise. The pre-icteric phase precedes the jaundice. It's for 1 to 21 days. Anorexia, nausea, abdominal discomfort, vomiting, constipation, or diarrhea. Heart, HA, that can't be heart attack. Headache. Okay. Malice, fever. Then the icteric phase is 2 to 4 weeks with jaundice and pruritus, so that would be excessive itchiness. So yellow and itchy.
That's because of the bile salts that build up in your skin.
Mm-hmm. Cool. I didn't know that though. Post-icteric phase, weeks to months, jaundice disappears, malice, they're easily fatigued. The manifestations of hepatitis. If you have hepatitis A, this is acute onset, mild flu-like symptoms. A lot of kids get Hep A and they don't ever know that they have it, but once you have it, you're immune. You will have a sudden aversion to smoke.
Yes. Ms. Bernacki mentioned that you have a sudden aversion to smoking.
I've always had an aversion to smoke, so maybe I had Hep A. There is a vaccination, and they can give you immunoglobulin therapy. If you have hepatitis B, it is an insidious onset. That's how you say that word, right? Insidious? Okay. Insidious onset. The symptoms are severe. There are lower GI symptoms. They're going to give you interferon treatments, alpha interferon treatments, Hepcera. You can get them immunized. Yeah. Hep C is often asymptomatic, increased rate of persistence, can induce chronic liver disease. They can do interferon there too, and Hep C is associated with unprotected sex, so is Hep B. And Hep C is really with IV drugs.
Now. Okay. So, 50% of all liver disease comes from alcohol abuse.
Speaking of,
right, we got some alcohol down here still. But if you notice, this bottle is actually unopened, so...
Yeah, I'm not really supposed to have this.
Yeah.
I'm just going to look at it longingly.
Let's see. Cirrhosis is often caused, hepatitis is often caused by viruses. And aside from the Hep A, B, and C, it can also be caused from CMV or Epstein-Barr. And, yeah. Sometimes from drugs.
Yeah.
So you have a couple different types of cirrhosis. You have 4 different types, actually. You have alcoholic cirrhosis.
Probably the most common.
Yeah, it is. You have post-necrotic liver cirrhosis, which can be autoimmune, toxic, from a toxicity or a viral infection. And you have broad bands of scar tissue with that. You can also have this isn't one of the types, but you can just have non-alcoholic fatty liver disease, which is a fatty liver, pretty much.
It's not associated with alcohol.
Right.
Hence, non-alcoholic.
Yeah. If you have metabolic syndrome, then you could be at risk for that. Okay, the third type of cirrhosis is biliary cirrhosis. And you have signs and symptoms of intermittent cirrhosis. It's caused by obstructions in the gallbladder. And basically your gallbladder just clogs everything up. And like those ducts there, they're all connected. So
your gallbladder
is lame.
It's lame. It causes problems. It's like joints. Causes lots of problems.
So you should not have joints and you should not have gallbladders.
Especially if your name is Ashley Glore. You should get a cholecystectomy this summer.
And you can also get cardiac cirrhosis, which is caused by right-sided heart failure.
And that one's cool.
Yeah, it is. Your
Not for the patient, but just to learn about.
Yes, your inferior vena cava and superior vena cava back up from the right side of the heart, and they back up all the way into the liver and cause cirrhosis.
All right.
So if you have cirrhosis, you want to have high carbohydrates,
high carbohydrate,
low protein, and low sodium diet,
and that's to help with your ascites.
Yeah.
Your symptoms are going to be really non-specific at first. You might have some right upper quadrant pain, anorexia, dyspepsia, flatulence, nausea and vomiting, change in bowel habits, pain, fever, weight loss, enlarged liver or spleen. Again, non-specific, could be anything.
So if you have liver disease, you can get esophageal varices, which are basically just like
hemorrhoids in your esophagus.
Yeah,
pretty much.
Yeah, or like varicose veins in your esophagus. Yeah. And they can rupture and you can bleed to death and die. You can get portal hypertension, which is due to increased resistance to blood flow through the liver. And you see increased pressure, splenomegaly,
and esophageal varices.
Yes.
Okay.
And hypertension. Jaundice. Let's see. Oh, jaundice is usually, if a patient comes in their jaundice, it's usually caused by an obstruction. They can have benign jaundice, but
that's not going to be on the test.
Yeah, it's not going to be seen often anyways.
If they have an obstruction, they're going to have clay-colored stools. Also, estrogen,
which is produced by the liver, can increase with alcoholism.
So you can get gynecomastia if you're a man, which means you're going to grow breasts.
Yeah.
And you'll have that gross Caput Medusa thing where you have like veins around your belly button.
You can also get spider angiomas, ascites, yeah. And you can get the red nose and palms.
Alcoholism, super sexy.
You want to check if they have cirrhosis. You want to check their PT, their PTT, and their vitamin K. And
hepatic encephalopathy is the ammonia. You're not there yet.
Oh.
I just wanted to skip ahead because I like this.
Okay.
If your liver is not functioning correctly, it's not going to be getting the ammonia out of your blood, and the ammonia can lead to brain disease. And so you're gonna have like confusion and I think psychosis sometimes.
Probably. But basically, you have unfiltered blood in your bloodstream, and it's terminal.
It's terminal.
Yeah.
Yeah.
Let's see. Oh, you can have a fruity sweet breath, which is
ketoacidosis.
No. Feeder hepaticus.
Feeder hepaticus.
That's the technical term. Basically, you have a fruity sweet breath.
All right.
That's because your body's not filtering out
the
toxins.
All right.
Yeah. We're almost done, guys. If you have ascites, which is the accumulation of fluid in your abdomen, you want to eat a high carb, low protein, low sodium diet. They might actually aspirate out some of the fluid,
but it's a temporary measure.
Right, it just comes right back. And they can also try giving you diuretics.
Yeah.
But it can only help to a certain extent. You want to remember, I get smashed
for pancreatitis.
Oh yeah.
Also, if there's a question about pancreatitis, please do not think about me. My case is atypical. So for everybody that missed that question on the test, I apologize.
Blame Ashley
for being atypical.
Beat her up.
Because I had a couple people and they were like, yeah, I got that one wrong because of you. Oh, sorry. I'll try to have more typical diseases in the future. So, pancreatitis, the test you're going to look for is lipase. It is more specific for pancreatitis.
Yes.
You have elevated lipase levels.
They also do amylase, but it's not as specific
because there's other places that make amylase.
So, typical signs and symptoms of pancreatitis are going to be sudden severe pain, flushing, cyanosis, edema, nausea and vomiting, a fever.
There's no fever.
A
low fever. Okay, you might have a low fever.
Because you have an infection, maybe.
Or you might not.
Leukocytosis, hypertension, tachycardia, and jaundice, maybe. Those are just
things
you
could get. You might not.
You want to remember, I get smashed. That's the causes of pancreatitis. It could be idiopathic, gallstones, ethanol, trauma, steroids, mumps, autoimmune, scorpion bite, hypercalcemia,
ERCP?
yes, which is the
Okay,
procedure,
endoscopic.
and certain drugs can cause it.
So my favorite is scorpion bites.
Yeah. So
There's
you
an
move to Arizona.
Yes.
You might want to know that.
You will.
I
I like those.
You can get a pseudocyst,
which is really gross. It is when like part of the infected part of your pancreas kind of walls itself off, and then you just have this ball of infection and necrotic tissue.
palpable, and it causes pain, of course.
Mm-hmm.
You can get a pancreatic abscess.
These things you can die if they rupture.
And I think that's
just about it. For pancreatitis, you're going to be NPO too, and you're going to want to work on relieving their pain, hydration.
Stop the precipitating problem.
Yes,
of course.
So if you don't know what the precipitating problem is, that's a problem.
It is.
Yeah. All right.
So we are done.
Enjoyed.
This was really long.
This was really long, and we apologize. But GI is just
there's a lot.
You have like 26 feet of GI tract. We had to cover it all.
Yeah.
And we haven't even shown you my stomach drawings yet.
We have.
Well, we have.
We
haven't yet in real time. But it's going to be at the beginning because Christopher did a phenomenal job.
So, anyway, the end. Okay. Bye.
Bye.